So when you're trying to rule in SI joint as an origin of low back pain, you've got a cluster of 5 tests that you should perform. If 3 of those are positive, it gives you a very good indication of whether you can rule in or rule out this diagnosis. The cluster of tests is pretty sensitive, so that means if they're negative, you can pretty much effectively rule this out as the origin of their symptoms. The first test is the Faber, which is flexion, abduction, and external rotation. You'll probably want to stabilize their contralateral ASIS, and you can give a little extra overpressure if there's not already a reproduction of symptoms with just the weight of their leg. So you're looking for pain back in the SI joint or some referral down the leg in the posterior lateral area. The next test would be sacral compression, where you can either do a cross arm position or a ipsilateral arm position, and you just kind of cup over their ASIS and apply a 45-degree angle of pressure in both directions, in theory providing some compression to that SI joint, and you're looking for that pain at the SI joint or some referral into the leg. The third test is the Gainsland's test, which I'm going to have you slide all the way down for me. It's very similar to the Thomas test, so go ahead and roll back and hug both your knees to your chest. You're going to stabilize one leg and you're going to let the other leg drop down. You're not really too concerned about tight hip flexors or anything like that. You're looking for pain in the SI joint here or some referral down the leg. You'll want to test both sides. Excellent. And let's have you scoot back up. The fourth test is the thigh thrust test. You want to bring your leg up into basically a bit of a fader position. You'll get your chest right over their knee and provide some quick anterior to posterior thrusts, looking for the same reproduction of symptoms in that SI region. The last test, can you roll onto your side, is a sacral distraction. Bend those legs up a little bit. You're going to get your body weight right over the side of their hip bone, right about that ASIS region, and you're going to provide some compression, which in theory is going to cause some distraction at the SI joints.